Hi everyone, my name is Lawrence Boer from the Digital Design Department at the IT University of Copenhagen in Denmark. And I will present this pictorial that was co-authored with Casper Heiselberg from the Department of Engineering of Aarhus University and Harvey Bewley from the Digital Design Department at the IT University of Copenhagen. The title of our pictorial is BGM Diary, Supporting Subjective Experience in Blood Glucose Management Training. In our pictorial, we look into what design can do to support people with diabetes. Diabetes is a group of metabolic diseases that is characterized by the body's inability to turn blood sugar into glycogen, resulting in high blood sugar levels. This can cause dry mouth, weakness, headache, frequent urination, blurred vision, or increased thirst. Such symptoms of high blood sugar are highly individual. In this work, we focus on type 2 diabetes. This type appears more in older adults and it's often framed as a lifestyle disease. People with type 2 diabetes are therefore often enrolled in treatment programs to learn how to live with diabetes. To manage diabetes, people use blood glucose monitoring devices, or in short, BGM devices, to find out how much insulin they should inject. There are applications that aim to support people with diabetes, for example, MySugar, OneDrop, or Glucose Buddy. In our analysis of these applications, we can see that they primarily focus on the quantitative physiological data that is gathered from blood glucose measurements. This is visible in the dominance of graphs and numbers, for example. We can also see that there is a functionality that allows people with diabetes to note down their behavior and mood. However, this is really supplementary functionality. In this work and design research, we want to challenge this and also make aspects related to subjective experience the focus of attention. In the pictorial, we present these 4 research activities to address subjective experience in blood glucose management training. We firstly deconstruct the BGM device to better understand what actually happens when we do a blood glucose measurement. And we take a closer look at treatment programs to understand current ways of learning to live with type 2 diabetes. Based on this analysis, we propose how design can support subjective experience. We propose the BGM diary. We lastly evaluate this proposal with a diabetes nurse to see whether or not we have been successful in supporting subjective experience. We started by deconstructing the blood glucose monitoring device. In particular, the Contour XT, which is a widely used model. You can apply a drop of blood on a test strip, and through an electrochemical process that is described in more detail in the pictorial, this Contour XT displays the glucose level. This is done with an apparent certainty of 1 digit after the decimal point. However, this is not as accurate as it seems. The Contour XT has a variance of 0.85 millimole per liter between 0 and 5.5 millimole per liter, and a 15% variance of measurements from 5.5 and above. This means that the actual value of, for example, 5.2 millimole per liter is in the range between 4.4 and 5.9. In terms of subjective experience, the measurement is, however, interpreted as a very precise outcome, which can prescribe how the patient should feel, potentially causing unnecessary anxieties. Following a type 2 diagnosis, people usually enroll in treatment programs that run for a year. In this treatment program, nurses provide education on diabetes, diet, exercise, and motivation. This includes learning how to use the BGM device. As a supportive tool, diabetes associations in Denmark offer a guess measure sheet. On the sheet, the person with diabetes guesses their blood sugar before doing the measurement, and repeating this process several times a day over several days aims to aid the person with diabetes in better sensing their blood sugar value. However, it also underplays the act of reflecting and understanding one's own experience, because it still reduces the experience to a single digit. And even though this estimate might be in range, it does not invite the patient to keep a qualitative record of one's subjective experience over time. Instead, it predominantly provides a quantitative account of these experiences. We thus have these 3 design insights that can inform design research. Firstly, that psychological aspects of diabetes management are not prioritized in current BGM designs. Secondly, the apparent preciseness of a BGM device can prescribe how a person with diabetes feels. And thirdly, that the guess measure sheet does not invite for a qualitative reflection on experienced symptoms. This led us to ideate on how we can support people with type 2 diabetes differently in their treatment programs. By differently, we mean a way that acknowledges the uncertainty of the devices in use and the uncertainties that are inherently present when guessing your own blood sugar level. Formulated as a design brief, this is design a training system for BGM devices for persons diagnosed with type 2 diabetes that supports an understanding of experienced symptoms and the device accuracy. Our design process resulted in the BGM Diary. This is a diary-like product that supports qualitative reflections on experienced symptoms during a treatment program. It appears as a notebook. Its name, form factors, and separation from the BGM device deliberately signal that the BGM Diary is an artifact dedicated to reflective documentation of reflective experiences. The BGM Diary follows a stepwise logic of guess, measure, annotate. The system thus repeats a similar terminology from existing training programs, yet these procedures are adjusted to recognize the patient's subjective experience. It works as follows. Before taking a blood measurement, the slider is used to guess the expected blood glucose value in the range from 2 to 24, which you can see here. A line appears on the left display. The certainty wheel can then be used to indicate the felt level of certainty. This results in a gradient around the line. This action captures the uncertainties and complexities that are part of starting to do blood work. The BGM device is then plugged into the BGM Diary, and the measurement is taken. A red line appears, and a gradient around it shows the value and accuracy of the measurement. By including this accuracy, the BGM Diary aims to leave more room for interpretation and more room for reflection on experienced symptoms. The paper notepad can then be used to write out reflections on experienced symptoms, such as feeling tired or experiencing stiff joints at respectively low and high blood glucose levels. Annotations can also be used to express aspects of subjective experience linked to the disease, complementary to the measurements. The annotations are meant to capture individual experiences over time. A scenario. Thomas, a 62-year-old person with newly diagnosed type 2 diabetes, finished dinner an hour ago. He feels heat throughout his body and is thirsty. He has tried unsuccessfully to drench his thirst in water. He uses the BGM Diary and guesses that his blood sugar is probably high, but probably not excessively high, something in a range of 8 to 10 millimole per liter. Thomas sets the slider around 9 and rotates the certainty wheel to show his uncertainty. He measures his blood glucose and sees that his blood sugar is much higher, at around 13. 1:15, I felt warm, and I'm still so thirsty. When I measured my blood glucose, it was higher than I expected it to be. The heat I do not recognize. When do I feel that? My blood sugar monitor is at 13.2, too high. The nurse told me I needed to remember to avoid my blood sugar is crashing too hard. I have added an afternoon snack meeting in my calendar, so I remembered to stabilize it. The proposal was developed conceptually, and we decided to evaluate it early on with a diabetes nurse to get feedback on its possible value. In a 1-hour evaluation with the diabetes nurse, we learned 3 things, 2 positive and 1 more critical. Positively, the diabetes nurse saw potential in the different ways of involving patients and also in externalizing the disease. On the negative side, the BGM Diary assumed that symptoms are static after and remain static after a training period, which they do not. So it involved patients differently. The BGM Diary can support a movement towards patient involvement where their perspectives and their illness come to the forefront of treatment, with a shared decision-making playing a larger part of the treatment. The BGM Diary can involve patients differently. The BGM Diary was also seen as a way to support externalizing aspects of disease management that can be difficult and taxing in the early parts of one's diagnosis, as a way to offload possible anxieties. But more critically, symptoms fluctuate. Symptoms are always affected by the patient's changing lives and bodies. And in our discussion with the nurse, it was clear that a short training period for which the BGM Diary was designed might thus not reflect this ever-changing body and symptoms. This opens up an interesting line of future design research. In summary, how patients, health practitioners, and designers model health and related self-care devices affects how a treatment is seen. Psychological aspects should be considered in the design of self-care medical devices, and designers can do so by working from existing practices, procedures, and technologies. With the BGM Diary, we offer a design research exemplar that addresses subjective experience surrounding blood glucose measurement, and particularly how symptoms are experienced individually. Thank you.